our whole goal that first week is to integrate and calm them down and get that trust started with them.
During the first week, the client's honesty and emotions will be tested.
For some reason, the addictive process stops psychological and emotional growth. So a 25-year-old may be 15 emotionally, even though they're bright, they're intelligent, they may be a college graduate. Emotionally, they're stunted, and so they have to work hard on their emotional growth once they're off the drugs.
A critical part of an addict's emotional growth and treatment at CARE is the primary group. In primary, the group gathers several times a week with counselors to delve into their deepest and most troubling issues, and to get to the heart of what may be causing their addiction.
When they come in from whatever's going on out there, in here, it's all about the group. It's all about the group process. The circle is where it begins and is where it will end for them. If they can respect what happens inside that circle, there's a good chance they're gonna make it.
I've just stuffed everything so far inside that I don't even know how to let it out.
Why did I do what I did? Why did I pick up that pipe? Why did I start lying? Why did I abandon my family?
I used when I was grieving, I used when I was excited, when I was happy, when I was celebrating, because that's what society taught me how to do.
I'm not really concerned about the way the others in the group think, what they think about me.
I don't want to take a drink today, and that's a miracle today.
All right, my name's Jody, everyone. I think I've met most of y'all. This is Drew. Drew's going to be with us the entire stay. The idea behind the whole process is basically these people come in and they have a very difficult time understanding how it is they feel exactly. You know, everything is so disassociated, disconnected, that they really don't know. I'd like to go around the circle and see how long you've been attempting to get clean. We're going to start with you, Connie.
I'm Connie. I'm 36. I have lived in Tampa. I was sober there for 7.5 years, relapsed. I can't do it alone, so that's why I'm here.
Okay, welcome.
Thanks.
Thank you.
Nice to meet you.
Nice to meet you guys.
My name's Maureen. I've been using for 25 years, but I'm here because I definitely need help, and I cannot do it by myself.
Good, welcome.
People come to treatment because their lives are totally unmanageable. They don't have a place to live, they have no more money to spend, they owe everything to every single person that they know, and they need to feel safe, they need to feel that people aren't gonna rob from them and steal from them, and that's what we try to provide. So the best thing you can do as a counselor is just kind of sit back and let the process take over.
My name is Moody. A year and a half ago, 2 years, I started smoking crack. And just like that, I lost everything I had. I've never been to a program before.
This is your first time in treatment?
Yeah, first time.
Welcome. Welcome, Abby. Stephanie, you've been here a few weeks.
21 days.
21 days. And this isn't your first time around?
No, it isn't.
Hi, I'm John. I'm 33, from Hoboken, New Jersey. I've been battling gambling addiction probably for the last 17 years of my life. Fortunately, I've been able to deal with my alcohol problem and have been in recovery for that going on for 4 years, but I couldn't do this on my own, so I decided to seek treatment.
Okay, good, thank you. Ultimately, everyone's here to get some help, and that's what we want to try to offer. This group here is to educate. It's not to make you feel better. It's to show you a way to get better.
Treatment isn't about comfort. It's not about people coming in and feeling comfortable, having a good bed, having comfortable chairs, having people talk to them in the tone that they want to be talked to. Treatment is designed to get people well. It's an arduous process. It takes a lot of time on their behalf. It's a very painful event, and there's a lot of discomforting things that happen in here.
I'm curious about you. You've been sober 3.5 years from alcohol?
3 years, 8 months.
3 years, 8 months. That's a pretty good run. That's a pretty good run at being sober. It really is. You were always gambling, I'm sure.
Gambling and drinking together.
You're very fortunate that you haven't drank. And I'll be honest with you, I'm suspicious of that. I'm not calling you a liar. I'm not. It's just, it's hard for me to wrap my brain around displaying all those behaviors. And I mean, you've been dodging the bullet. But it's very difficult to be walking around selfish and dishonest, gambling, or whatever the behavior is. I'm not picking on you particularly, but you're an interesting case, I have to say, and I want you to know you're right at home. Don't feel like, because I've been sober a few years, and these people are just coming in. An addiction's an addiction, and man, if you're here, your life's a fucking mess. It's just the way it is. People don't come here because their life is good.
Well, right now, they have nothing. The only thing they have is their ego and their personalities, and that's what you'll see manifest in their behavior. The first thing they have a tendency to do is put their guard up. They try to protect themselves from their surroundings. The facades come up, as you see in John. The lies come popping out.
What we want to do, what addicts want to do, is feel better. So we quit drinking, we quit doing drugs, so we start acting out with gambling. We start picking up eating disorders. We start hitting the gym all the time. We start having sex all the time. We need these rehab romances. You know, that serves a purpose. It allows me not to feel my feelings. That's the reason I use drugs. And what happens is when I pick up these other unhealthy behaviors other than alcohol and drugs and hide behind my clean date, whatever it is, it serves its purpose. It does. But we're sick. We're not bad people. This is an illness. Addiction is an illness, okay? And we're sick. So if we're sick, we have to get well. We have to get better. And I'm here to tell you, a byproduct of getting better is to feel better. But that's the route we have to take. I'm not coming across aggressive to be aggressive. I just want to make the point so we can get to work.
In group, I did get a little insulted. Jody, the counselor, who questioned my sobriety and how I have not picked up a drink in 3 years, 10 months since October 28, 2000. I don't know sometimes. I felt it was wrong of him to question my sobriety.
He needs to realize that he is new in recovery. You know, because if he was in recovery for all this time, he wouldn't be in this treatment facility treating addiction. Addiction isn't that I drink too much, it's not that I gamble too much. It's the behaviors and the reasons I do these things, what's driving it. And he hasn't been willing or hasn't been able to take a look at it yet. You know, his walls are starting to come down a little bit, but at the same time, they're not down far enough. We're going to start Friday at 11, and we're going to have an agenda. And I will do my end to be prepared when I come in here. Which is going to be up to y'all. Welcome.
The adrenaline rush of gambling is the same as the alcoholic or the drug addict. The difference is that gambling is far more dangerous. By the time the gambler is ready to seek help, he's in real deep, real far, and has no way out.
Jody put a dent in John's defensive armor. John has little time to dwell on it as he moves on to his next treatment session. John has suffered chronic leg pain since having surgery as a young child. CARE has many tools to help their clients, both emotionally and physically.
The Western therapy is the tough work. The Eastern therapy is the recovering, is the nurturing, is the bringing them in and taking care of them when they've been stripped down to the core.
I've always had a little bit of closed-mindedness about acupuncture.
Acupuncture is wonderful for pain relief. To cleanse the body, the internal organs, from mind, body, and spirit, because that's what Chinese medicine is.
Recovery is like peeling an onion back. Every time you peel another layer away, you have soft tissue underneath. In the case of addicts, you've got soft, painful tissue. So we want to get to the core of why they're addicted. In order to do that, we've got to get through all these layers.
Deep breath in and out.
John didn't even mention that he had chronic pain when he came into my office. In fact, he really didn't even like the thought of having acupuncture.
All right, John, we are done.
Okay.
Thank you
very much. I appreciate your time.
But I convinced him just to give me some trust and let's try it and see what happens.
Definitely feels a little bit better, but I think it's because I was so relaxed. I don't know. I still think they're full of There's the honest answer.
Next on 28 Days in Rehab, Jason is lost in recovery.
I can't understand if it was good or bad what I'm doing.